I'm just going to read one of the questions which we have received at the time of registration. So one parent has said her nephew has the age 6 years, exon 44 deletions, and currently on deflazacort. So do they need to add any cardiac prophylactic drug for cardiomyopathy? Exon skipping or gene therapy treatment, is it available in future for this? And the child
What was the mutation you said?
Exon 44 deletion, and the patient is 8-year-old on a wheelchair.
44, 8 years, and already on wheelchair?
Wheelchair position, that's what they said.
Okay.
Maybe they're using it for long distance, so I don't know. I have no idea.
Okay. Yes, I don't know if that family is in the call. I'm happy to talk. If they're in the call.
Dr. Vandana, I don't know if she's there.
Okay.
Vandana is around. Can you maybe, if you're there? I can't see her.
Yeah, maybe maybe
she joined. I don't think so she joined.
Yeah.
Okay. Maybe that kid is not on steroids. So he's kind of too young to be on wheelchair. I think from a cardiac medication perspective, right? I'm sure you guys know the standard of care for cardiac medicines.
The child is on deflazacort. That's what she has written.
Okay, on deflazacort. Okay. Like from a cardiac medicine perspective, it's it's used prophylactically. So we usually say, start around age 9, 10, but now the trend is even earlier, like 7, 8 years, you can start them prophylactically. So you start with, maybe what's called ACE inhibitor, like lisinopril, or other things first. So I think it's a right age to start.
Another person wants to know what is the current status of research on LGMD2C, gamma.
Yeah, so I think the LGMD. So give me 1 minute. Let me take this phone call real quick. Sorry, guys. I'm just gonna take this call real quick.
I request Sunilji and Ajayji to please put your questions in the chat box, please.
I also want to tell there are some questions which are being repeated, and questions about the new drug. Doctor has started the webinar explaining the whole thing. So when the recording is available, maybe you can go through it. I have seen a couple of parents asking about VAML and explain update about that. So he has already explained, sir, in the beginning itself. So I'm not taking those questions, and I'm going on with other questions which have not been asked, which have not been answered, or which are not repeated.
Yeah, ma'am. Yeah, ma'am.
I already put in the chat box.
Yes, sir. Those all will be answered by sir.
Hey guys, I'm sorry, I'm back. So for limb-girdle 2C, I think 2C was the question, right? Yeah. For 2C, I think the one lead program that I'm aware of is Raptor still in is planning on some sort of gene transfer therapy, which is still in the preclinical stage. It hasn't come to the clinical stage yet. But they are also doing a natural history study, which is just kind of looking at how these patients with LGMD type 2C overall they progress and how do they do to get more understanding.
Is there any company which is using mini-dystrophin instead of micro-dystrophin? If mini-dystrophin use, is it including exon 18 and 19?
Right. So I think from the gene therapy, gene construct, like what type of exons, there's slight difference, but it's just the terminology is just semantic. It's a language difference. So microdystrophin Raptor's product is called microdystrophin. Pfizer's product is called mini dystrophin. So I think or if you're asking the construct includes 18 and 19, I have to go back and check if the Pfizer construct includes 18 and 19. But all of these can be used for boys who have mutations or deletions involving exons 18 and 19.
Another parent wants to know their son's exon deletion is 49 and 52, 13 years old, and he also has little scoliosis problem and is not on any steroids. So should they give him steroids, or is there some other solution for it?
Yeah, I mean, it's again, you can discuss with your physician, but I don't know. Again, it comes to goal. What's your goal now to start steroids? Of course, if you want to protect the heart, just at least slow down the progression and keep where it is already, maybe you should think about starting the steroids and the heart and the breathing part. I think that's, again, it comes down to your goals and what are we trying to accomplish. If it is a scoliosis, I don't think it's going to reverse the scoliosis, but definitely from a heart and the respiratory breathing perspective, it may be worth considering.
So how do we bring these trials, like gene therapy trials, to India? That's what somebody has asked us.
Yeah, we all are trying for that. I think it's just there's so many there's so many factors, including government, political factors, and there are, but in spite that it's taking time. But I know there are some exon skipping trials that now that's Sarepta has started in India in several centers. So I think it's coming. It's just we're still working through the challenges.
Is there any option for 3 to 19 deletions in gene therapy? Any update about it, please, about dystrogen?
So if you're talking about the gene transfer therapy, so I mean, technically we can, if you're saying 3 to 19, the whole part is deleted, then that includes 8 and 9. So right now there's no gene transfer therapy. But there are plans to start trials for boys who have mutations that include exons 8 and 9, especially deletions that include exons 8 and 9. So that's gonna happen in a year or two, within the next year probably, with like I said, with additional strong immunosuppressive agents. Dystrogen, I think that's they're doing the stem cell therapy, I think. I don't have a lot of details, but I do know, they presented their data in recently in one of our meetings, the Muscular Dystrophy Association meetings here in the US, and it wasn't, they were not giving us a lot of details when the questions were asked, and there was some controversy and challenge surrounding that in terms of if that whatever they're showing is accurate or not.
Another person wants to know, is there any treatment option for LGMD2B?
Now in terms of treatment, still in the preclinical trial phase also.
In gene therapy, which exons are excluded and what is the inclusion age group?
So that's I don't know if you're talking about the clinical trials or if you're talking about the one that was just approved. We're talking about the approved therapy now in the US. It's the Sarepta's product, and that the age group that's approved for right now is age 4 and 5, and they of course if the patient has any deletion that includes exon 8 or 9, they are excluded. Other than that, everyone else is included. If you're talking about the clinical trials that's going on, that's going to depend on what trial and what company. But most of them have excluded boys who have mutations involving exons 1 to 17 from the clinical trials.
Thank you. And what is the efficacy of Amandos 45 for patients? Oh, sorry, that has gone. For a patient,
yeah,
son is 5-year-old.
Yeah, so it's again, it's the we know there's some dystrophin expression after Amandos 45, and I don't think we have like long-term data to tell how is it effective in terms of slowing down the disease progression, but we do know there is some dystrophin expression from from the exon skipping agents, but it is not not as robust as you would see in a gene transfer therapy, but there is some dystrophin expression.
Any treatment option for hemizygous duplication,
That's
the
a
13 to 17? MLPA probe ratio is 1.91 to 2.10. Age is 5. Kid is ambulatory. Will he be eligible for Elevidys?
Yeah, I think it's 13 to 17 duplication, which I think he would be eligible for Elevidys. And now I don't know if he turned 6, maybe difficult. But again, I think that the question here is going to be access to the treatment. You know, we can treat him. He can come to United States for centers who treat international patients. But then, how are we going to bear the cost? And that's going to be a difficult challenge.
What could be the inclusion criteria for gene therapy, Sarepta and
Yeah. So for Sarepta, I think most of their, at least in the United States, the clinical trials are actually completed as of right now. Completed recruitment. I don't think they are recruiting anymore. But the first study they had was age 4 to 7. And the one that was just completed for older boys, that was older than any non-ambulatory boys. That was in the United States. In the ex-US, ex-United States, now some of the other countries, the age for Sarepta is 8 and older. I don't know in the other countries if they're still ongoing, but I know in the United States, the Sarepta's trial is closed. For Regenex Bio, it's age 4 to less than 12, and they have to be ambulatory, meaning they have to be walking.
Okay. Another parent wants to know their son is 9 years, DMD, exons 48 to 50 deletion, using deflazacort 15 mg daily dosage for the past 2 years. He's enrolled in Sarepta clinical trials for eteplirsen drug, getting weekly intravenous infusion for the past 6 months. Trial is supposed to go for another 2 years. Kindly throw some light and guide with the future course of treatment for the son.
Yeah, I think it's good that he's actually getting the Exondys 51 at a person. I don't know, I'm not sure if it's a placebo-controlled trial or it's open label, like he's actually getting the drug. We do know, metoprolol, there is some, again, there's minimal dystrophin expression, not as robust as gene transfer therapy, but there is dystrophin expression. We do have boys that we follow long term. There is some benefit, but you have to follow them for 5-6 years before you actually, to say that they actually have seen differences. But I think it is there. It's very minimal. It can preserve the heart function, it can preserve the respiratory function, but the amount of dystrophin that's being produced is low with exon skipping agents. And going back, I think we have to make sure that he's on the right steroid dose, which is also important. Optimize the dosing and based on the kid's weight, and also you have to weigh that with any risks associated already if you had any side effects from the steroids. But I think that, again, on top of that, you have to make sure he's taking the heart medications, other things are being checked, his vitamin D levels, his bones are being checked, and other things. Okay.
How much benefit can we get from exon skipping?
Yeah, it's going to differ based on what exon skipping agent you're using. We do know, like I said, we do know it's all the ones, eteplirsen. There's Vyondys 53, which is exon 53 skipping. There's Amondys 45, which is 45 skipping. There's another one called Viltepso, which is also exon 53 skipping agent. There is there is some dystrophin production, there is some benefit, but it is very hard to quantify, and it is going to be variable also based on the age, the actual disease status of the boy, when did we start that, and it is going to be very variable, but there is some benefit.
Is there any trials for exon 39 duplication?
Not specific for exon 39 duplication, but all of these the gene transfer trials and other, the Edgewise and the Capricorn, all of these all of these trials include boys with exon 39 deletion or duplication.
Parent wants to know any update from Satalos, Canada. Will it help to reverse the condition?
I don't know. That's something that I have to look into that. But I have to look at what kind of technology that they're using. But at least what we know so far, I don't think there's anything that could actually reverse the condition.
Yeah. This is, I think, a repetition, but the parent wants to ask you, what is available for exon 8 to 9 deletion? We have already explained, but if you can.
Yeah. So right now, from a gene transfer, the gene therapy perspective, we don't have any gene transfer therapy available. So that's at least the research for the when I say gene transfer, I'm meaning either microdystrophin or mini dystrophin. Microdystrophin is being used in Sarepta and also Regenex Bio. Then mini dystrophin is used in Pfizer. And there is also another company called Solid Biosciences, which is going to start doing some trials. As of right now, there is no trials that actually include boys who have deletion exon 8 and 9 or any sort of deletion that includes 8 or 9. The trials will be available in the next year or so. In terms of other things, of course, they have to be on steroids, they have to be on other standard of care measures for cardiac, from pulmonary perspective, and some of the other non-genetic targeted trials, right? That they're not targeting the genetic part of it, but like, the Capricorn trial, and also Edgewise, which focuses on the muscle degradation. Those are available. Those clinical trials are available.
Yeah, there's one question which we have received. They say that my son is 28 years old with deletion 55 to 60. Any hope for him in the near future? And what are the lines of treatment anticipated for this age of children?
So how old is that?
28.
28. Again, and the deletion was
55 to 60.
Okay. Again, I think if there is, there's going to be, you have to weigh between the risk benefits of whatever treatment that you're going to do at this age, in terms of, especially when gene transfer therapy, when it gets expanded to everyone. Other than that, steroids is also a weight. It's also a weight, weighing between risk and benefits. If he's already on steroids, how much? I wouldn't recommend starting him on steroids right now. And then in terms of, I think we talk a lot about the standard of care. I'm not sure if Veerapandiyan has access to, you can refer to PPMD website or other websites where actually there is, the standard of cares are listed out. We have to make sure that that's being followed. I can share the screen, but I don't know if maybe Veerapandiyan can work on some of the resources like this if you haven't done that before, to kind of spread the standard of care guidelines that we follow right now. So if you go to the Parent Project Muscular Dystrophy website, it's actually listed all here, and it tells what things need to be done at what age, what medications need to be considered at what age for ambulatory, non-ambulatory, all of that here. So I think it may be a helpful resource for you all. I just want to show you the website, so just you guys are aware of it. And there are also publications about it, which I can share with the team if you guys want that.
Yeah, another parent wants to know, can we get enrolled for Capricorn in US and the following doses in India? Any update about estromide utrophin modulator? Sarepta brought this at the last stage and closed the project. So
okay. So as far as the Capricorn question, I don't think they have trials in India, so you have to continue that here in the United States. You have to be staying here, or you can go fly back and forth. So I have to look up on the utrophin modulator project. I'm not sure about. I mean, of course, I don't know if Rapta brought out. I don't have any, any details on that. But that I have to look up where I don't know about the status of that. I can definitely look into that.
Yeah, one of the questions we received would be, what will be the likely cost of vamlorine? No, sorry, I pronounced it wrong.
Of a Molaron? Yeah.
In India, especially.
In India, I don't know. So the company hasn't released any cost. Obviously in the United States, it's this is going to be marketed by a company called Vamorolone. I mean, by a company called Catalyst. When I think it's in India, I don't know. I think it's probably a company called Santhera is going to do it. They haven't announced the price at all, but I think we're all, as a community, we're all getting our physicians and everyone, we're all guessing that it's probably going to be as similar to Emflaza's price that we have here. So I think that's our thought process, but we don't have any information on that. The company hasn't released that yet. I think here, even though it's approved, they're not ready to. We won't actually get the drug until January or February.
Would that be covered by insurance there?
Yes, I think that's another challenge, right? Since it's still a steroid, it's going to be even with starting here in the United States, even doing Emflaza, some states mandate that we have to try prednisone and they have to show failure of prednisone before they go to Emflaza. So I don't know how this is going to play out. They may come back and say, you have to try either prednisone or Emflaza before you want to try vamorolone. We just don't know yet, but there might be some policies surrounding the coverage from the insurance.
Parent wants to know, his son is 11 years old with deletion 49 to 55. What is the treatment that he can be given? He's not getting steroids.
Yeah, I'm just, it's just, I don't know why steroids are not being, I don't know if it is maybe not being used as widely or is it hesitant to start steroids? I mean, he's 11 years old. I don't know how old was he when he was diagnosed, but it's disheartening to see that he's not on steroids. Maybe he was tried on something, but he did not, maybe he didn't tolerate well, but I mean,
just to intervene. Sorry, just to intervene, I'm Rama here.
Yeah.
Coming to the steroid care, sir. In India, most of the time, many of the doctors doesn't know that is Duchenne muscular dystrophy. There is a standard of care to be given, and many of them are under the misconception of the disadvantages of steroid. The main thing is like the importance of standard of care. The one which you shared is being accessible to few parents. Few of them who are unaware of the disease, they are not knowing steroids, and few who know, they are being frightened by the
side effects.
Effects of it.
Yeah. No, I get it now. I think, we need help from the physician community to explain to them and help make the families understand the risk versus benefits. So I think, they should be on steroids, and then from a cardiac perspective, he's since already 11, he should be on some sort of medicine to help protect the heart. And if you're looking at more genetic modification therapies, of course, once we have, right now there's no clinical trials except Regenex Bio. That's something that's available in the United States if he's still ambulatory. But all of the trials that you're going to be in, they're all going to need you to be on steroids for at least 3 to 6 months before you could get into the trial. So that's something to keep in mind, because that is a standard of care.
Doctor, are there any clinical trials going on for respiratory management and to maintain the stability of the pulmonary issues?
Good question. No, no trials as right now that's going on. I think it's going to be more proactive care in terms of starting to use the cough assist device at the right age, starting the non-invasive ventilation at bedtime. Again, following the standard of care, we're able to protect the breathing. But no specific medicine that's being tried. There was a study, there was a medicine that was tried, but but it wasn't, it wasn't successful. So that study was closed. It was Santiago actually tried a drug called idibenone, I think, but then that's not being used anymore. But no respiratory muscle study right now going on that I know of.
Parent wants to know, when you said Capricorn reverse, do you mean from non-ambulatory to ambulatory?
No, Capricorn does none of the trials actually reverse the disease. If I said that, I'm not sure if I said that, but I don't think. No, there's none of the trials that we have here would reverse non-ambulatory body to ambulatory. None of the treatment that's available right now would do that.
One question we received was, what is the treatment for deletion in exon 40? Is there any treatment that can be given for deletion in exon 40?
So of course, like again, going back to the standard of care, when you talk about treatment, the steroids can be done, all the standard of care, cardiac medicines, and vitamin D and those things should be done, and also gene transfer therapies and those are all exon 40. Those are all available. So is it exon 40 deletion?
40. Exon 40, yeah.
Oh, 40, but I think then I think it's probably a milder phenotype if it is 40, right? It's inframe, probably they have Becker, and not Duchenne. If that's the case, again, there's no clear guidelines for standard of care for Becker. Most of the times we use low dose steroids if they start showing weakness in Becker muscular dystrophy, and of course the cardiac medicines can be considered based on how good the heart is doing.
Yeah, parent wants to know if the gene therapy is possible for 49 to 55 for their child, and which hospital is best if they go to USA, and what could be the likely cost of treatment?
Yeah, so there are few centers in the United States that are actually treating international patients. I mean, we are one of them, Arkansas Children's. The cost is going to be including the drug cost and also the cost right after the post infusion monitoring. The drug itself is $3.2 million US dollars. So the estimate is going to be depending on the hospital. So in our hospital, we give estimate of $4.9 million total. That's going to be in the same ballpark. 3.9. Sorry, not 4.9. 3.9, but it's going to be somewhere between $4 to $5 million based on where this is the estimate that you're going to get, based on this which center that you're going to go to.
What is the general challenge for gene therapy in older boys?
I think that the challenge, there's a lot of challenges. Main is going to be they're heavier. You're giving them a lot of vital load. So the safety issue is the biggest thing. Since you're giving a lot of viruses, there increased risk of developing immune reaction to those viruses, the vectors.
Is there any how does one enroll themselves for the clinical trials going on around the world?
So I think one of the I'm going to put in, so clinicaltrials.gov is a website where you could actually go on and check what trials are going on. And the PPMD and also Cure Duchenne website, they also list all the clinical trials that's been going on. So if you go to the clinicaltrials.gov, they have they have all these trials that's going on, if they're recruiting or not, and they also have the contact to the specific site. So I put that here. I'm happy to share my email address if anyone has any questions in terms of how to access what trials have. I'm happy to help in the United States. And also the clinicaltrials.gov will give you also other countries the trials are being going on. So I think this is probably the best resource. But if you go to the PPMD website that I put the link before, that can also they also constantly update the clinical trials and the sites that are doing it.
Thank you about that. Thank you so much. And is it the approved gene therapy, is it a one-time dose, or how often do they have to do it? And what
So
would be
the,
the value of that?
yeah.
Is it 5 years or 10 years?
So it's also, we currently do not have, we have data up to like 4 years. So the first 4 boys that were treated, they were doing okay. They were actually doing good for 4 years. That's why we have data right now. So there are discussions about redosing. Should we redose them after 5 years or 6 years, whatever duration that is? But that's all still being discussed. The one that's approved right now, it's one time. As of right now, it's one time. And also the clinical trials are also one time, but redosing is something that's definitely being considered and discussed. We just have to, we may have to get into think more and more research has to go on to that. But there's clearly, there are boys who respond, and there's also boys who don't respond to gene therapy.
Yeah. In general, people want to know how do they take care of Duchenne muscular dystrophy children, and what are the management techniques that they have to follow up for this?
Yeah, I think it's I don't know the specifics, like, in terms of what specifically we want to know. There's a lot. Yeah, we want to make sure that, like I said before, if you go onto that website that I shared, have different aspects of care, like, what do you have to do from a steroid perspective, what do you have to do from a heart perspective, what do you have to do from a pulmonary perspective, also from a physical therapy, rehabilitation perspective. All of those are there. I think that would give you some basic information, and connecting like you guys do here. I think connecting with from a logistical standpoint, right? Sometimes what to do at home, it happens, connecting with other families locally who are all working with boys with Duchenne would help, would be a tremendous help also, like you guys are doing that. I think that would also help a lot.
Yeah. Is there any likelihood of a cognitive progression in children with DMD as they grow older and become young adults?
So cognitive progression, meaning getting if the IQ and stuff is going to go low, probably. I don't think there's going to be a progression, but if they already have cognitive, some of these boys can have autism spectrum. They can have language delays, some cognitive delays. You would know that from the get-go. It doesn't get worse. It's not a progressive from that perspective. It doesn't get worse, but they may have that ongoing cognitive issues. Sometimes it does get better when they get older. I don't think it gets worse from a cognitive perspective.
Does any surgery, long surgery, like say scoliosis surgery, have any effect on the neurological condition of these children?
No, so the scoliosis, one of the key things we talk about introducing steroids early on is to actually prevent having the scoliosis surgery. So we have actually in the United States, we were able to actually prevent them from having a lot of scoliosis surgery. But the ones who have had scoliosis surgery, doesn't affect the neurological status. Mainly, it's to help with their breathing part. It is recommended. It can help with maintaining their breathing status. And then I think the question about right age for introducing nice splints. I think we usually say there's no age. I think I would probably say before they start to decline. So probably 3 to 4. You have to make sure if they have if they have any sort of tightness in their heel cord, I think that's the age to introduce even before that.
Yeah.